So I'll be talking about family history as related to acute abdomen. All right. So a patient actually pulls up at the clinic and they tell you that they have this abdominal pain that's so intense and it started just recently. So there are some questions you want to actually ask them about your family, about their family, that will aid you in your diagnosis and treatment. Okay. So looking in depth on family history, some things that you are supposed to actually ask the patient, okay, that presents with acute abdomen as in related to their families. Okay, so let's define it. We said that family history is essential in patients with acute abdomen. Okay, and this is to identify potential genetic or familial conditions that may have contributed to the patient's symptoms. Okay, so it could be that it's not really acute abdomen directly, but their family is known to have all these stomach problems. Okay, so these are the things you're supposed to ask. Okay, so you want to ask about gastrointestinal diseases, like, does anybody in your family have peptic ulcer? Does anybody have inflammatory bowel disease? Does anybody have any gastrointestinal cancers? Okay, you should always ask all this. Then, in related to pancreas, you ask, does anybody has pancreatitis? Does anybody has pancreatic ulcer, cancer in your family? Right? Then liver diseases. You ask if anybody has liver cancer, anybody has liver cirrhosis, anybody has what? Hepatitis in their family. Okay? You note all this. Then ask about other conditions. Okay? Like, does anybody in your family have diabetes? Do they have hypertension? Do they have any cardiovascular disease? Okay? So you are doing all this to identify the following. You are trying to identify hereditary conditions like what? Familial adenomatous polyposis. You are trying to identify if there's what? Hereditary non-polyposis colorectal cancer. And you're also trying to identify if there's what? Peutz-Jeghers syndrome. Okay? And also, all these disease conditions that we mentioned, you are trying to know if they actually run in the family. Okay? These ones are just additional ones. Then you're also trying to look at if the patient has increased risks of what? Appendicitis, diverticulitis, inflammatory bowel disease. Okay. I'm also trying to look at potential genetic predisposition like what? Cystic fibrosis, which could result to what? Pancreatic insufficiency. We are trying to look at familial hypertriglyceridemia, okay, which could cause pancreatitis. Okay. So a thorough family history can help you aid in what? Early diagnosis. Earlier on, just know what is wrong with this patient. Okay. Because we are talking about acute abdomen. Abdomen is complex. You don't really know what in the abdomen has gone wrong. Okay, so you might want to actually ask all this. Then it will also help you in your targeted workup and imaging. It will help you in your management and treatment. It will help you in genetic counseling and screening. Okay, so that's it about considering family history in patients with what? Acute abdomen.